up fat somewhere on our bodies that we would like to get rid of, or at least move somewhere else. Well, we can do that. It is called fat transfer surgery. And it is a big celebrity trend, and it's being done right here on the Sun Coast. Dr. Monica Betty is here to explain this new technology. Great to see you, Dr. Betty.
Yes, thank you for having me, Stephanie.
So it's definitely showing up on social media. I appreciate it when celebrities admit to things that they're using to look better. Tell us a little bit how the overall process works.
Yeah, great question. So overall process, the way it works for fat transfer, we harvest fat or remove fat, which is called liposuction or liposculpture. We take the unwanted fat. Most commonly, it's in the lower abdomen area or the love handles, the flanks area. We harvest that fat, we spin it, we purify it, and we can transfer it to all parts of the body. Even to the face, the hands, and even the buttock area too.
So we hear a lot about it in the rear, you know, BBL, that's sort of where it became known. But I feel like, especially in our area, it's not necessarily about having that, you know, big rear look. Jenny McCarthy just came out and said she put it in her hands. Now, I don't know about you, but I could look at my hands and see that they have definitely showed my age. How does that work?
Yeah, so similar process. Everything's done in our fully accredited surgery center. We harvest fat, so most commonly it can be from the belly area. We take the fat, harvest it, spin it, purify it, and then we add it to the hand area. We usually add it to the top of the hand, so minimal downtime, about 2 weeks of social downtime, and good amount of uptake. Usually we're seeing more than half of the fat is taking in the hand area and can last years.
That's interesting. I also have a lot of girlfriends that for various reasons have decided to no longer have breast implants and instead are transferring fat to sort of reshape their body. What are some of the advantages of using, you know, your own cells and fat, if you will?
Yeah, Stephanie, great question. So again, using own fat, we take it from the belly, transfer it to your own body, so almost 0% chance of rejection. Has stem cells in there, so as your body heals, new blood vessels will grow in, and it's just a very natural appearance. So most of our clients want natural appearance, natural looking curves. We do it all through hidden entry points, meaning you're not going to see afterwards a tiny scar.
Oh, that's impressive. If you can do it with a hidden entry point too, how does that help your recovery time? You're not looking at big incisions that have to heal?
Yeah, super tiny, probably about the size of a pencil eraser. Tiny incisions, minimal downtime, minimal swelling. Most people back to their job in 2 weeks and going back to their full activities around the 2-month mark.
Okay, so let's take a look at some of Dr. Betty's work because it is impressive what you can do just by moving things around. Now, full disclosure, the before girl doesn't exactly look terrible, but for whatever reason, I see she wanted some more ab sculpting. Describe what you've done.
Yeah, so this woman, she's a local. She came to see us. She was going to the gym, living a super healthy lifestyle, just had stubborn areas of unwanted fat. So we did Lipo 360 on her. So we contoured everywhere from her neck to her groin on the front side. Same thing on the back side from her armpit to her upper buttock area. And we really contoured her body, and we used technology called Renuvion to help internally tighten and shrink wrap her skin. And she's seen about 1 year out in the after photo.
Wow. So you really are able to sculpt a body simply by moving cells and fat around.
Yes, 100%. So this one was Lipo 360 only, but some women will take the fat, harvest it, purify it, and will transfer it to other parts of the body, such as the breast or even the buttock area, Brazilian butt lift.
All right, let's take a look at another picture and describe what has happened here. What a transformation. That's stunning.
This beautiful woman, came from the Midwest to see us. She actually had liposuction elsewhere in the before photo. She was unhappy with her curves. She wanted a natural, a balanced appearance. So through all hidden entry points, we did Lipo 360, again, from the armpit to the groin area on the front side. Same thing, the armpit to the upper buttock on the back side. On her, we did a fat transfer to the buttock area, so BBL, Brazilian butt lift. Harvest that fat, transfer it back to the buttock area, and she's about 1 year out in the after photo, living a great life, and she sent this, that photo from her beach vacation.
Oh, well, she certainly looks phenomenal on the beach, that's for sure. And by the way, this isn't just for women. I know plenty of men who are working hard at sculpting their abs and certainly would appreciate a little help.
Yeah, so it's a super growing popular and trend for guys to get body contouring as well. So we did Lipo 360 on this guy. The number one thing that he wanted is really defined and etched abs. So he was going to the gym, living a super healthy lifestyle, had unwanted areas of stubborn fat, belly area, love handle area. So we did Lipo 360 on him, and we took the fat, we harvested, purified it, and added it to his upper pec area, his chest area, and to his deltoid area as well. So as he works out, and he's seen about 6 months out in that after photo, his chest is going to look more defined, his deltoids are going to look more defined. everyone wants that beach body. Everyone wants the abdominal muscles, but we've got to make sure the chest and the delts match so it looks as natural as we can.
And for women, especially aging women, where are some of the places that having a little extra fat or moving it is beneficial?
Yeah, so most commonly we're doing in the face area. So number one, the face is very common. The hands is also very common too. So those are the top two areas we're seeing is the face and the hands besides the buttock and the breast area.
Okay, and I quick want to give a little look inside your facility because I know you have a very nice surgery center on site. Tell us quickly about this.
We have a fully accredited surgery center in Tampa, Florida. So all of our procedures are done with a board-certified anesthesia provider. We are for our out-of-town clients, we offer virtual appointments. So we see our clients virtually afterwards. We see them in person afterwards. Then all of our clients too actually get custom-made garments. They're fajas, compression garments, to really help them get back to that beach body as fast as they can and decrease the swelling.
You can learn more about body contouring online at tampasurgicalarts.com.